Exacerbations of COPD are commonly treated with systemic corticosteroids, antibiotics, or both, and may require hospitalization. The treatment offered is likely to reflect physicians' best efforts at phenotyping the exacerbation. It is not clear whether the events treated differently have distinct clinical characteristics or whether these events lead to different future outcomes for patients. To address these questions, we performed a post-hoc analysis of data from the large TIOSPIR trial. This study included more than 17,000 patients with COPD who received tiotropium via two different devices, the Respimat or the HandiHaler. For this analysis, we have pooled the two treatment arms. 8,061 patients had an exacerbation treated with systemic corticosteroids, antibiotics, or hospitalization, and were included in this analysis. There was generally no difference in how exacerbations were treated by geographical region. Exacerbations treated with systemic corticosteroids, with or without antibiotics, were also associated with a higher risk of hospitalization for another exacerbation or death compared with exacerbations treated with antibiotics. Exacerbations treated with systemic corticosteroids, with or without antibiotics, were also associated with a higher risk of hospitalization for another exacerbation or death compared with exacerbations treated with antibiotics. Patients who had an exacerbation that required hospitalization were at the highest risk of future hospitalization or death. These results have implications for COPD research and for clinicians managing patients with COPD. The way COPD exacerbations are treated is a useful guide to the patient's future outcomes. So therapies that reduce the number of systemic corticosteroid-treated events and hospitalizations may be particularly impactful for patients. These findings may also help clinicians to better identify patients who are at a higher risk of poor outcomes.